I'll bet if you had to be tested for lung cancer, you'd rather have your breath analyzed than to have a bronchoscopy where they stick a tube down into your lungs and end up doing biopsies and other tests, and keeping in mind that CT scans have a 96% false positive rate.
Right.
Looking for lung cancer.
There are a lot of little nodules in the lung that are hard to differentiate on CT scanning from cancer and a benign nodule. So a study was done, in the Journal of Thoracic Surgery in September of 2012 that showed that you could actually do breath testing and see what chemicals are exhaled in the breath that might be characteristic of a cancer. Now, this isn't really a big surprise because years ago we reported on this show
about the dogs,
about sniffer dogs, and breast cancer. And they could fairly accurately tell who had cancer and who didn't. I remember going to the doctor's office and having a conversation with him and said, keep the dogs away. I think I'd rather just not know. So we left it at that. But
so how do they test the breath anyway?
Well, they use special tests that are spectroscopy and gas chromatography oriented.
What are those?
Those are specialized research tools that analyze all the chemicals that are exhaled in the breath, which is what we need. And if there are characteristic ones of cancer as opposed to benign nodules, then you have it. And in this particular study, they showed that you could do that.
This could have a significant impact, on complications from invasive diagnostic procedures.
These tests that we do are invasive. You're taking tissue away. You're having to use an anesthetic. And there are complications that occur. And sometimes, you wind up with infections or other kinds of problems. There's a lot of psychological trauma that goes with having to do something like this, too. It scares the heck out of you when somebody finds a nodule and says, well, in 2 weeks we'll take a look. It'd be a lot easier to just take a little breath sample, run it through the analyzer, and see what you find.
Well, plus it would be less expensive.
It would be a lot less expensive, and of course you wouldn't have to be in the hospital to do that.
I think it's interesting to note, too, that many lung cancers clear up on their own.
Well, they do. A lot of cancers do. And you look at breast cancers, for example. You look at women who are 50 years old who died from other causes than cancer, like traffic accidents, etc. About 30% of those women have an invasive breast cancer. But when you look at women that are 50 years old, not 30% of them are going to die from breast cancer. So a lot of these resolve on their own, and you'd like to know which ones to worry about and which ones not to.
Well, that's what I thought was interesting about this test, because it determines the type of a nodule it is.
If it's a benign nodule, that's great news. And if it's not, you've got a problem. And then you can do more of a workup that's more aggressive. And the other thing, of course, is we should be looking at other body fluids as well. How about checking the urine to see what kinds of chemicals are excreted in the urine that are specific from people who have cancer and don't, or from the sweat, like we do from some other kinds of tests that we do, like screening for cystic fibrosis. So I think we're at the tip of a new era in medicine. We're going to be looking at other ways to make diagnoses and doing the direct thing of taking tissue through a biopsy and doing tests that give you radiation damage while they're doing it. And this is one approach that I like. I think that will be safe and give us good answers.